Hi, this is Dr. Yu of Sky Facial Plastic Surgery. Today we're going to go over upper blepharoplasty. This patient mostly has upper eyelid skin redundancy and very little fat that needs to be removed. I like to mark out the patient's upper eyelid creases while they're still upright. Once we move to the operating room, the patient's face is cleansed with some betadine.
Maybe kind of pulling at the eyelids a little bit here, just kind of keep them as relaxed as you can.
Next is probably the most important part of the operation, and that's where I determine how much skin can be removed. I do this by grasping the upper eyelid skin with green forceps. As you can see, I'm holding in my left hand here. I start bunching together more and more of the upper eyelid skin until I can see the upper eyelashes start to rotate upward, but the patient's eyes are still closed. That tells me that's the most amount of skin that I can remove, but the patient can still blink and close their eyes. Next, I inject the local anesthetic or numbing medication. I perform this after doing all measuring and marking so as not to interfere with the accuracy of the amount of skin that can be removed. Next, the excess or redundant skin is removed. There are many ways to accomplish this: scalpel, scissors, electrocautery, laser. I prefer to use a scalpel with limited electrocautery for hemostasis. This allows the tissues to heal quickly with very little bruising.
I'll take a little bit more local.
Did you get as much as you could?
Yeah.
There's a lot there.
Next, to close the incision, I like to use interrupted sutures along the lateral aspect as this carries the most tension. I use a running locked stitch for the rest of the closure. Meticulous care allows the scar to nearly be invisible. I then move to the other side, and the skin is similarly removed. Not shown here is a very small amount of fat was removed from this patient's medial eyelid. She had very little compared to most other patients. Only the equivalent of 2 grains of rice was necessary to be removed. For upper blepharoplasty, I like to leave the muscle entirely intact.
Alright, well, we are all finished. How are you feeling?
Good.
Get a little nap there?
Yeah.
Okay, good. So, how was the experience?
It was so easy.
Yeah.
Very easy. I don't know, it was like we started and then it was done, and I definitely didn't think it was going to be like this. I thought it was going to be much worse, so it was like I'm really pleasantly surprised.
The sutures remain in for 5 to 6 days. Thank you for watching.